Hey everyone, Dr. Tanner Dobson, and this is an abscessing molar that we're going to be removing in this video. This is a tooth that had a root canal done a number of years ago, but unfortunately developed an abscess around the distal root, likely due to a root fracture. So we discussed options and decided to remove the tooth. We're going to begin by administering a mandibular nerve block, and that's going to freeze the quadrant of teeth except for the posterior buccal gum tissue that we're going to supplement with half a cartridge of articaine into the long buccal nerve. And you can see that the tooth is actively abscessing here. A bunch of pus coming out of the sulcus and numerous fistulas. Like I say, it's likely that this tooth had a root fracture because you usually don't see infections this severe from periapical infections, especially when they're draining. So we're going to separate the gum tissue from the tooth using this Molt periosteal elevator. And then we're going to apply some traction force to the tooth using these cow horn forceps. And fortunately, abscessing teeth typically come out quite simply, and this one was no exception. And then we're going to begin removing the infectious soft tissue from the socket. Infection this severe, we can be sure that there's going to be lots of granulation tissue to remove, so we're going to spend some extra time doing that. So that the bone heals up nicely, we're going to scrape it out with a curette until we're back on healthy bone. And once we're satisfied that the granulation tissue has been removed, we're going to place some gel foam into the socket and have the patient bite down on some gauze. Patient wanted to keep the tooth because it had a gold crown on it, so we're just going to rinse it off and give it to the patient. Put it in a little box. Change the gauze out and give the patient some painkillers and send them home.